All right, good morning, guys. I am Dr. Neely Walker, Equine Extension Specialist with the LSU Ag Center. And despite some of our technical difficulties, this morning I've got Dr. Rebecca McConnico from Louisiana Tech, who is a veterinarian and a professor and does all kinds of amazing things for the equine industry. And she's graciously agreed to talk about equine respiratory diseases with us today. So any of you who are on the Zoom meeting, if you have any questions, please feel free to jump on the Zoom group chat and send over your questions that way, and we'll address them as we get to them, okay? All right, Dr. McConnico, I'll give you the torch.
Good morning, everybody. Hope everybody got their chores done, get some coffee. It's great to be here. I am coming to you from North Central Louisiana, Ruston specifically, and I'm happy to be here to talk about respiratory disease. I just have a few slides I was going to share with you just to review a little anatomy. I'm a professor, so I have to do some of that, and just kind of give you a visual of what we're specifically talking about. Let me get this pulled up. All right. So I wanted to just remind everybody about the equine respiratory system and some of the different things that we deal with in horses that others are not, don't have to deal with, like the guttural pouch, etc., things like that. So let's look at this first one. This is a sagittal or a sideways section, cartoonish type picture showing that the upper respiratory tract of the horse, and some things that I wanted to point out. Horses are obligate intranasal breathers, so they don't breathe out of their mouth. They can try to breathe out of their mouth, but it's not going to happen. Therefore, the upper respiratory tract is really a critical point where if are disease processes that can totally shut them down. So we'll talk a little bit about those things. I know people this time of year want to hear about Heaves or chronic obstructive pulmonary disease, and there are quite a few new things in that. We'll talk about that in a minute, but let me just kind of review a little bit. You've got, let's see if I can use this little thing. You got the nares here, the nasal cavity, and then you've got some areas where if there's an obstruction that's going to occur, you have such narrowing, it's really going to affect the dynamics of inspiration and expiration. So you've got the nasopharynx here and the guttural pouch over here, and then you've got the epiglottis here, and then the trachea. And so some points that, let's see, let me get back off of that. Go over here to this one in the middle, a little bit more about the guttural pouch. So the guttural pouch is a dilatation of basically the ear canal. So the eustachian tube, and there's a little bitty slit-like opening that empties into the pharynx. And so when the guttural pouch, which is used to help with equilibrium, help to assist with air cooling, and when it gets sick, it can get a lot of exudate in there and can cause a lot of abnormalities that affect function of the larynx and can affect lots of different parts of that upper respiratory tract system. And then you've got the nasal, the sinuses, there's several. They kind of hover around the eyes, and there are areas that then communicate with when there are diseases of the teeth. So we can talk about that a little bit. We've got several areas of lymph nodes that drain the head of the horse. So you've got your mandibular lymph nodes between the mandibles, obviously, and then the parotid lymph nodes, which are kind of at the base of the ear. And then you've got the ones deeper that are really close to the larynx and the pharynx. And so those drain the head. So when they have diseases of the upper respiratory tract, they can become swollen and purulent. Those are the ones that are most commonly affected with strangles. But if those get so swollen, they can obstruct that upper respiratory tract. Therefore, animals may have to have emergency tracheotomies. And you can see on this one where it's kind of laid over a live horse, where all those kind of interplay together. When we go down to the lower respiratory tract, you've got the trachea moving into the main stem bronchi, and then to each side of the lungs, and the bronchioles, and then the alveoli. And then this is what you've heard a lot about on the news with, and I'm only going to say COVID-19 does not affect horses. However, inflammation affects all of us similarly. So in horses that have respiratory diseases, lower airway diseases, these alveolar sacs or alveoli, where the actual air exchange occurs. So let me get my little pointer out here. So you've got a bronchiole here, and then you've got an alveolar duct here, and then you've got these little bitty alveoli, and this is where the actual air exchange, the CO2 comes out, gets blown out of the respiratory system, and the oxygen is delivered in. And so you've got the red blood cells picking up the oxygen at that point. And so when you have horses that have, or humans or whoever that have inflammation, a lot of times these airways fill with fluid, and they can no longer do any air exchange, and it affects the whole body. So that's kind of wanted to give you a visual on that. Just real quickly, this is the time of year we see, well, winter, well, all times of year, we see strangles. It's actually reportable in every state, or most states. It's reportable in Louisiana. Not saying that everyone does that reporting, but there are a lot of states that are really good about reporting, a lot of owners that are good about it, and they can track that disease process. And so strangles is caused by Strep equi subspecies equi. So Strep equi. It's highly contagious, highly it's spread very easily. Most younger animals are affected by it compared to older. It's got an incubation period as little as a couple of days up to a week or so, 12 days. You see fever, lethargy, the swollen lymph nodes, especially those ones up in the intermandibular area. And then the retropharyngeal ones, the ones around the larynx, when those get really swollen, they don't easily drain in that location. And so they impinge on the upper respiratory tract and cause obstruction of the upper respiratory tract. Okay, I'm gonna switch over here to Heaves. I know this is what you guys are really wanting to talk about today. We start seeing Heaves in animals at all ages. It does seem to get worse with age. We have lots of different names for Heaves these days. Asthma, back when I was in school, so this is gonna date me, 30 years ago, we were not allowed to use the term asthma because it was so different in horses. But over the years, they've done a whole lot of research and found that it really is very similar to human asthma. So we call recurrent airway obstruction Heaves, COPD, which is chronic obstructive pulmonary disease. All those are forms of asthma. There's also a form of asthma called inflammatory airway disease that does not have an obstructive form. It does not convert or merge into obstructive disease. And so that's of the younger athletic horse that you'll see that causes very similar signs. And we can talk, if you have specific questions on differentiating that, we can talk about that. But basically, horses with equine asthma, environment is so important, and environmental management, along with things you can do for prevention. We can talk about that. But as far as a veterinarian, when your horse is showing signs of obstructive pulmonary disease or Heaves, recurrent airway obstruction, there's several processes that have to be followed to rule out pneumonia and to rule out other signs, other causes of diseases. And so a lot of times there'll be normal blood work associated with those animals. So pulling a blood sample is not an unusual thing to do to have that animal evaluated. There's a stall side test now that we use called an SSA. It's a serum amyloid A that can kind of give you a quick, is this inflammatory disease or infectious disease? It tells you the level of inflammation. It's just another one of those tools in the toolbox. We also use a complete blood count. endoscopy can be very helpful. That trachea that you see in this slide is showing that what we call that mucopus right here. And it's basically a whole lot of mucus. It's usually beige colored, not green, not yellow. And that's one that can kind of just support your diagnosis of chronic obstructive pulmonary disease. We also will use ultrasound, sometimes radiographs to rule out diseases that can kind of give a similar picture, like pneumonia, like pulmonary effusion or pleuropneumonia. Horses that have infectious diseases of the lower airway will often have fever, will often be lethargic and not feeling as well. So horses with asthma aren't systemically ill. They just have more of a labored breathing, or what we call dyspnea, D-Y-S-P-N-E-A. And then we can do tests that will immediately bronchodilate those horses to see if the airways will open up or bronchodilate. So then 2 more slides and we'll get to the questions. What we feel is most commonly associated with causing heaves, and that will also exacerbate pneumonia or infectious diseases, are going to be those respirable particles. And we've identified some molds, and it's really the molds in the environment. So in the different parts of the United States, so down in the Southeast, so Louisiana, Florida, Mississippi, Alabama, parts of Arkansas, etc. And if horses are out in the pasture when these respirable particles are there, then those are the ones that are implicated in causing that allergic reaction. So in the South, we move our horses indoors to treat that. In the North, it's the opposite. It's the horses that are in the barns in the wintertime when the hay is stored in the barns and they're in those barns. They have more of a winter associated obstructive pulmonary disease. And then my last one, I just wanted to just throw this out there, is the viral pneumonia, because viral pneumonias are very common. They're, for the most part, preventable with good hygiene and good vaccination programs. It's usually those horses that are stressed. So young horses traveling, athletes in training, the malnutrition, the horse with malnutrition or the unwanted horse population, and then horses that are immunosuppressed. There are also some really interesting studies coming out about, they call it inflam aging. So the older the horse gets, the more prone they are to inflammatory processes. So that was my last slide. And I saw some questions coming in. And there was one question I saw that about why is the mucus built up? Why do you see so much mucus built up? So what happens is there's a whole inflammatory process that goes on. And so part of that process is, you know, in response to those allergens, the process is where the more mucus is produced. So it's mucus plugging of those airways all the way down into the parenchyma of the lung. So those bronchi, so you got the trachea to the main stem bronchi that then is like the tree of life, basically branching all the way down to those alveoli. All of the walls of those bronchioles have mucus producing cells that are basically amped up in an inflammatory process. So they're going to secrete mucus to try to get rid of those antigens or mitogens or foreign particles, respirable particles, to try to get the horse to get rid of those particles. There are epithelial cells that line those airways all the way down to the alveoli, and they have cilia on them, so little finger-like projections. And so between the cilia with the mucus, they're going to try to get all that stuff out. And so that's why the horse coughs up a lot of mucus. So, and you won't see the mucus necessarily coming out their nose because they swallow it. So what you'll see is them have some big gooey coughs, and then my kids say hawk up a loogie basically, and then they'll swallow it. And so you'll see that sort of thing. You won't necessarily see a lot of exudate coming, or a lot of pus or mucopus coming out their nose. All right.
The second question that we got was, is photic head shaking syndrome relevant to today's topic?
Good question. It depends what's causing it. So head shaking is more of a couple things. It could be an ear problem, an inner ear problem. It could be anything from parasites from the external, like the pinna of the ear. But deep down, you know, they've got a middle and an inner ear just like we do. They've got the stylohyoid bone that you actually can see if you put an endoscope into the guttural pouch, which is super cool because it's like a window to the inside of what's going on in the horse. And so some horses that have otitis interna or otitis media, which is inflammation of those the bones and or the soft tissues associated with that. So it is definitely part of the head. It doesn't necessarily cause respiratory disease. There are some horses that have what we call a trigeminal nerve neuropathy, which is inflammation of the trigeminal nerve, which is the fifth cranial nerve. And it has been shown in horses to be caused by an inflammatory process. And so it will lead to them head shaking that can secondarily cause trauma. All right, hang on.
So we got another question that just came in. We have a participant on the line who's asked, her horse is currently on allergy shots to address a Heave condition, and he's coughing quite a bit. Is that a normal reaction to the shots? And then when you're treating a horse for Heaves, and I'm assuming that it's somewhat managed, would you recommend decreasing exercise, or can they continue as normal?
Great questions. Let's see, the first one is the allergy shot. So most of the time, horses with a chronic respiratory condition associated with allergies, so asthma, you have to do multimodal therapy and management. So probably the one most important thing is environmental management and minimizing the dust and the molds. And I mean, there's only so much you can do, especially if you don't have a facility that you can, I mean, the best thing is to put them in an air-conditioned stall with no hay. And, you know, that will actually rescue one from that allergic airway disease that's been set off by environmental type allergens that we're talking about. The allergy shots themselves should not cause them to cough more, if that's the question. There might be some additional things that need to happen as far as diagnostics. Let's see. There are so many other things that can be done to manage it. So we can talk about some of those. Probably the one that's most commonly used is systemic corticosteroids, but that long-term is not going to be your best management practice, but it is often included and it will often give you the best response and the quickest response. So using combination therapies that include managing their dust and their allergens, and then some sort of anti-inflammatory corticosteroid to get them back into a better plane of comfort. There was the previous question also asked about, let's see, what was the second part of, I'm kind of jumping around here. The second part of that last question was
to decrease exercise, or if they can exercise.
Oh yeah. Okay, so yeah, so exercise. So if obviously if exercise is making them cough more, and that they don't stabilize and just get a few coughs done and then they're good, if it's going to make the coughs worse, then you need to be doing some other things. There are the aerosolization techniques that include giving aerosolized corticosteroids. There's some other anti-inflammatory products that can be given via that nebulizer, or the the multi-dose inhaler type things. And you can spend a lot of money on those. Some horses respond really well to those. I had a good friend that has a show horse, would go into show season right when they started showing signs. And so they would basically do everything possible to environmentally manage that animal. But then they would, a couple of days before going on the road, they would do the multi-dose inhaler using some corticosteroids and some other anti-inflammatories. And then during competition, what was allowed, would use the nebulizer then, or the inhaler then, and then a couple days afterward. And then when they got back home, they didn't need to use it so much because they could manage things better at home.
Yeah, I'm gonna, if you don't mind, Becky, I'm gonna interrupt you for just a second. I'm gonna share my screen really fast. I've got a list of just 10 easy things that you guys can do to kind of manage a horse with Heaves at home. And a lot of these you've already talked about, but just for those people who are a little more visual, I'll share this. So what are some of the things that we can do just basically as a management from standpoint at home, right? So a lot of the things that we do, we're gonna minimize the mold that is in the inhalants that are agitating our horse in their environmental situation. So we're gonna soak their hay. And when I say soak their hay, it doesn't mean that you soak their hay and then you give them the wet hay and the tea or the soaked water that goes along with it. You pull the hay bag out of the water and then just feed them that soaked hay. That can kind of rinse the hay of some of the excess molds and particulates in it. It won't necessarily get rid of the mold. It'll just kind of wash it off of that hay. I've also seen a lot of research done on steaming hay. However, here in the South, it may not necessarily be the best option. And if you do go a steaming route, that is going to get rid of quite a bit of the mold and the spores on the hay. And they have different size steamers that you can use for either just a couple of flakes of hay. You could do a half a bale of hay, or you can do a whole bale of hay. And I'm not quite sure that I'm convinced that steaming a whole bale of hay would be efficient here in Louisiana or anywhere in the Gulf South, just because of the humidity and the mildew and the mold issues that we already tend to have. The other thing that I like to tell people is don't feed your horses from round bales if they're already suffering with some type of upper respiratory issue. Especially Bahia round bales seems to be a bigger culprit for holding the specific mold spores that cause this upper airway disorder. Feed a horse a complete feed from a pelleted form if it's really bad and you can't manage it with hay. Again, here in the South, we tend to see like a summer pasture associated airway obstruction issue. So we're gonna bring our horses in the stall. If you're up north, you're gonna take your horses out of the stall and increase turnout time. Another recommendation I saw is that you can move stalls. So don't keep the horse that has an upper airway issue in a low roofed barn that has hay in the loft. Try to keep them in a stall that's close to the door with tons of ventilation, lots of fans, trying to get, and not fans on the ground, but fans that pull that hot air and that all the particulates kind of out of the top. You can switch your bedding, right? So straw is going to be the biggest culprit for increasing mold and particulates. Some of the research I've seen has focused on using paper shavings or using cardboard shavings or even peat moss. Again, that's just going to increase your management issues and cost of managing these horses in the stall as well. Don't clean your stalls, obviously, when the horse is in it, because that's just going to kick up all of the dust and all the particulates up in the air. Again, increase your ventilation. You can use nebulizers. You can use, like Dr. McConnico was talking about, using corticosteroids and other medications with the help of your veterinarian. And there's also been some recent research that's actually fairly impressive. It was a blind study that touts quite a bit of success with ponies that were affected with this condition, and seeing a lot of actually being able to manage these horses more effectively when they supplemented with omega-3s. So those are just some of the easy things you can do. I say easy. again, having a horse with Heaves or upper respiratory condition is going to increase in management no matter what you do. There's no easy, quick fix for these horses. Dr. McConnico, do you have any comments? Have you seen any of the pros and cons of using nebulizers or the omega-3 supplementations?
They've actually studied omega-3s for years, and it's great. It's a really great anti-inflammatory supplement if it's done correctly and if we're using the right formulations. It actually competes with the omega-6s a little bit. And so the omega-6s are the pro-inflammatory, and so it decreases those. And there are a lot of good products out on the market. But you just, make sure when you choose a product like an omega-3 supplement that it's a company, make sure it's a company that's done the research and that does have good quality control and product control and that has a good track record of that, because you can just be overwhelmed. And if you just go in looking for the cheapest one, that's not necessarily going to be your best product. As far as the metered dose inhalers or nebulizers, there's several on the market. And I have people that are truly committed, that have a very successful athlete or really want to pursue one and not lose them to a respiratory condition like this. They're very committed. The horse cooperates and has a better quality of life, enjoys competing. I think using metered dose inhalers along with all these things that you listed, and in addition to some other medications, the bronchodilators when they're competing, that can help, like the buterol. So there's albuterol that works really well within the metered dose inhaler. And then there are oral forms, there's a clenbuterol, which is the generic name. That one's actually going to help, and as does the albuterol. It helps those mucociliary, we call it a mucociliary apparatus in the airway. It helps promote that stuff to get out. It helps that part of the lining of the respiratory tract to get that mucus out of there. When it's built up so much. So, but it's multimodal treatments to address all these different aspects that contribute to the disease process. There are also a lot of, there's some acupuncture points if people are interested in pursuing that. There's a lot of research that supports acupuncture point treatment for this disease, as well as some of these other diseases that we see. There's some herbal medicines that you can look into that have some that are evidence-based, that are worthwhile pursuing as well.
Another question, so from Daniel, he asked, so since this is like asthma, can they have it their whole life, or is there anything we can do to get rid of it?
Great question. A lot of them, what will happen is they probably will have some level of it their whole life, but they can have it managed. Some years will be worse than others, and it just depends on that environmental load. And if you can anticipate when that horse is going to begin to have problems, and if you can somehow minimize their exposure to that, you can manage it, and they'll have a less response if you can go ahead and get that under control. So, I mean, it's one of those things where they don't necessarily grow out of it, but it can appear that they might be growing out of it. But it might just be that your management of your animal is better.
Is this a condition they're born with, or is it something that they're responding to?
They are born with an immune system that then over the years, just like all of us, some of us have different ways we respond, and some things seem to be familial or genetic. So I would say, has it been shown to be genetic? There are papers that in the past and coming out that suggest there is a genetic component to it. So You know, it's just so many variables involved with it, in the whole immune system and certain animals, you know, sort of survival of the fittest, basically, from way back when. All right, what else do we have questions on?
I think besides, one of the things that I did get a question on before we got started was kind of the pros and cons of the nebulizers. And besides the actual medicines that are available, if using a nebulizer is something that you would like to do to kind of manage the overall performance level of the horse that you have, and it kind of fits in line with the associations that you may or may not be showing with, or whatever your ultimate goals are. Nebulizers for horses specifically have become increasingly more popular and are available to the general public. What's not available to the general public are going to be some of those prescribed medications. You're going to have to work with your veterinarian to get those. However, if you have a really nice performance horse that you're trying to manage and kind of keep in that performance line until you can use them as a breeding animal or something else, or retire them, or if you're just trying to get one more year out of them or something along those lines, you can buy one of the nicer forms of a nebulizer for about $1,000. The thing that you need to be careful about is making sure that every time you use it, it gets cleaned really well. The problem with inhalants and someone that has upper respiratory disease, myself, you don't want to be introducing any types of molds or spores or anything that's dirty from the machine itself into the airway, right? So you can get a lot of good done with these nebulizers. And I would caution any of you who are, I see it a lot at some of the barrel racing events or some of the big rodeo events. There'll be people who, lay people or even trained people that are not necessarily veterinarians that have purchased these machines and are offering treatments at these events. I would caution you to use your best judgment in participating in some of those treatments at those types of events. Just not only they're not a veterinarian and they're not supposed to be diagnosing or treating animals without a veterinary degree or a license, but also you don't know how sterile that equipment is and what's being introduced to your animal. So you got to be careful how you use those things. If you're going to do it, make sure you have your own equipment, make sure your tubing and everything else is clean on a regular basis. Another question is, Sophia asked, she has a question about a different equine disease. Go ahead, Sophia. We'll try to answer it as best we can.
Can I say something about nebulizers? And
yes, please.
Okay, so a nebulizer is a little different than a metered dose inhaler. So a metered dose inhaler, you can, there are a couple of them that are in the $100 range. They're a little simpler, they're handheld, they're pretty easy to clean, and they basically give puffs of medicine, and the medicine has to be, should be prescribed by veterinarians. So any kind of medicines, as Dr. Walker was talking about, need to be in concert with the veterinarian. Of course, I'm going to say that I'm biased because I am a veterinarian, but people, you know, we're trained in infectious diseases, and probably one of the worst things you can do is use a nebulizer from someone that doesn't know what they're doing, and you're going to introduce diseases. I mean, that's how diseases are transmitted. That's the aerosolization directly into the lungs of something that you have no idea. So just be really careful with that. Another thing I want to mention on the, back to the soaking hay, steaming hay, that has to be fed really cool. And I think Dr. Walker did mention, you know, you had to use it very quickly. It will tend, in our environment in the Southeast, it will tend to mold and make things worse. And just making that clear that it might work in some situations, but feeding that right away is really important. Plus it gets kind of sour after a while, and the horses don't usually like it either. So just keep that in mind if you're thinking about it, because you could spend a good penny on steamers, but there are some good ones out there. And especially if you've got a horse prone to respiratory disease and is a equine metabolic syndrome horse combo, steaming the hay is good for that disease process as well. All right, I missed the question already from Sophia.
Oh, it was about irritable bowel syndrome. I told her just to email me and that we would answer it since it's kind of out of the scope of this conversation.
Okay. Okay.
Does anybody else have any questions about upper airway disease or about managing? It doesn't necessarily have to be Heaves. It could be, Dr. McConnico had talked about some viral pneumonias. She also mentioned Strangles. I kind of feel like those are a little different than the line we've been discussing currently as far as Heaves goes. But I do have a question. Do you see, do you think that in your experience that horses with Heaves in humid conditions are more difficult to manage, not just necessarily from the environmental aspect of it, but because of the heat, the temperature?
Okay, yeah, great question. So the question is, are they more difficult to handle in the heat? Are you saying?
Yeah,
okay.
due to humidity, you know, because my thought process, you know, horses mainly cool themselves through the respiratory process and through sweating.
Yeah, so it definitely can make them more difficult. I've also noticed, and this I don't think is, I've noticed a lot of non-sweaters are also heavy. So I think those kind of can go hand in hand. So not only do they lose their cooling ability because of the non-sweating, but then their backup, having the respiratory cooling, is affected as well. And the other thing those horses will do, especially the really tough ones in certain times of the year, they won't eat and drink because they're trying to breathe. Because, you know, that, you know, any horse that's feeling anxious because they're having a hard time ventilating, then on their own, you know, they're not going to go stick their nose in a bucket to eat or drink because they're just trying to spend all their effort in breathing. And they can get so bad that they're breathing with their whole body, their whole being. And so that's why you'll see a heave line on some of those horses. They're thin. The heave line will stick out a little more just because those muscles are more visible. And those muscles are working harder to try to help that animal get that oxygen and CO2 in the right location.
We do have a question from Julie. Are liquid supplements better than powdered supplements? Does that matter?
I think it depends on the powdered ones, usually it depends on how you're going to give your powdered supplement. So if you're putting it as a top dressing and the horse is nuzzling it around and dumping his bucket or whatever, it's going to aerosolize it a little bit, and it might not go into the animal. They may not ingest it. And so the liquid ones, if you're putting it directly in their mouth. Now, if the powdered ones, you're making it into a paste. So it really just depends on your ability to get the whole entire product into the animal. So in some animals, it might be easier to do liquid, and others, it might be powders better.
Okay, now, two questions we have. Are there trauma-related respiratory conditions that we need to be concerned about?
Yeah, I mean, trauma can affect any animal. I did want to mention, this is the time of year the snakes are coming out, right? And so venomous snake bites can really cause a serious problem that can be life-threatening, because if you've got a horse that got bitten on the muzzle and now their whole head starts to swell up, so that's not necessarily, it's somewhat of a trauma for that, but you can actually cut off the end of a garden hose and help them breathe until the veterinarian can get there to help with the other aspects of it. So that's kind of one of those quick, if your horse needs an airway and it's got a big swollen nose from a snake bite, and it's, you know, the nares are soft tissue, they're not bony, but once you get past the nares, then you've got the nasal passages, which are supported by bone. And so those usually don't need, the snake bite effect isn't going to affect that part. So if you can just get the nares opened up, that's one thing. Now, as far as other traumas, horses and sides of barns during storms are a fairly common scenario. So they'll, horses fight, horses get injured. They can have crush injuries. They can have lacerations that affect the upper respiratory tract. They can have sever their trachea. And so they actually a severed trachea alone, as long as they can still get air into their lungs, but eventually that there's going to be other things that get into the airway with that. So they're going to need repair of that, surgical repair of situations like that. Other traumas, I mean, any kind of blunt trauma, hit by car, hit by truck, hit by logging truck we've had. But usually the horse is the one that's hitting something. You know, they're running into something or getting in a fight or whatever.
We do have, Daniel asked, what if they don't have access to a stable? How can I keep my paddock clean so my horse has a less chance of getting it? And
that's the Heaves that we're talking about. Yeah, that one is probably one of the most challenging ones. So if you've got a horse, and it depends on what the ground is it, the best thing to do would be put them in a dry lot and dampen, keep the dry lot dust free. Meaning keep it moist. So, you know, you can sprinkle, have a, you know, sprinkle situation. You can put them in a round pen with rubber mats, you know, just some way to get them out of the pasture where they're going to be exposed to those mold spores. But that's probably one of the more common scenarios. You have horses that are always out on pasture, that you don't have a place to put them. But if you can get them away from the pasture, even just a little bit, and keep them, you can keep a fan on them, blowing the respirable particles in, you know, above their head, to try to keep those molds and things. I mean, there are also contraptions, I guess, or different things you can put over their nose. Since they don't inhale from their mouth, you can put, they actually do make some face masks for horses that they can breathe through them, but they can also filter out. The problem with that, the horse doesn't usually like that. They don't like something over their nose. They don't feel that immediate benefit to having that. But there are some that some horses have tolerated.
Okay, here's another one. So Jillian her horse makes this strange sound when she's working, almost like a high-pitched wheezing after she gets into an exercise bout. Could that be buildup or a blockage due to some type of upper respiratory issue?
Okay, great question. Anytime you can hear with your ear without a stethoscope, if you can hear something, that's usually a narrowing or an abnormality or obstruction of the upper respiratory tract. I have heard wheezing from Heaves, though, with my own ear, but usually those horses that are that bad aren't going to work for you. So if you've got that horse, I guess I would ask, how are you holding the horse's head? What is it, Western, English? Is it, you know, they've got their head flexed, their neck flexed? And does it make it better to extend the head? So I guess I would, as a veterinarian, I would want to hear, and you could videotape what's going on with that horse. Get your GoPro on or whatever, have someone video you with their cell phone, and you can send that into your veterinarian, have your veterinarian look into that. So there could be something in the airway. It could be an epiglottis problem, a dorsally displaced soft palate. It could be a laryngeal problem. They can get little chondroids on their retinoid cartilages that it's under exercise you can hear a noise. Usually the upper respiratory tract, the higher up in the tract, the deeper the pitch. So when you say high pitched, that one, you know, I would just say you probably need to have somebody pass an endoscope. And even one of those overground endoscopies, I think you can get those done for a couple $100 nowadays with people that have those, with veterinarians that have those. Maybe $300 was the last time I saw that charged out. But that would be interesting to find out. Keep us posted.
All right. Well, Kristen tells us just insight, some hope for everybody else who's managing horses with Heaves. She personally has a horse for the last 10 years that has had Heaves. She's literally done everything: allergy shots, tests, pasture barn management, planted new grass, soak and hay. They moved up north even. They're starting to use a nebulizer now on her. She's kind of an advanced age, and she's happy, and they're still able to ride her. So there's a little bit of anecdotal evidence that suggests that these horses aren't just going to be pasture pets. It's just gonna take some increased management on your part. We also have from Mary Jo. She says she uses on timers to kind of help her horses with Heaves. So speaking to, kind of keeping the environment dust free. Daniel, that's a great opportunity for you too, to use if you don't want to go out and wet the pasture or your dry lot down on a regular basis. You can set up some misters. Does anybody else have any comments, concerns, questions before we wrap up? Dr. McConnico, do you have anything else that you'd like to mention?
I guess I would just emphasize, if there's any way for you to anticipate, keep records, anticipate when those animals are going to have their episodes starting, to try to do whatever it is that you can do to decrease the inflammatory response and get that horse to where the episodes are more controlled, and you can minimize and help that animal minimize those episodes that are so tough sometimes to get under control. So if it's after the fact, it's going to be a lot more difficult. So just anything you can do to start early on your management. I'm a big believer in pelleted feed, whole, complete pelleted diets on those animals.
Well, we do have one more question from Melanie, and this may seem silly, but for you guys managing horses, this may not be silly. This may be a burning question for you. When her horse coughs, he also passes gas. Is this an indication of any other issue, or is this just kind of pressure?
Oh, you want me to take that one?
Yeah, you can answer that one.
I think, I mean, when an animal coughs, they're using their whole body. So it's good that they're passing gas. We don't want them to keep the gas inside. So any kind of effort that involves the abdominal muscles to expel gas, whether it's the front end or the back end, it's, I guess if it's excessive coughing and excessive flatulence, they kind of do go hand in hand because of that effort that is used to get the gases out and to get the mucus out of those animals. So I guess I would make sure your veterinarian's on board and the one that helps you keep your animals healthy, to see if that's out of the ordinary for that particular animal. I know some animals are more gassy than others. So, just try to keep a record and find, to figure out, is this a normal scenario for my horse?
All right, well, with that thought, I'm going to wrap us up. If any of you on the Zoom meeting or any of you who are going to watch this later have any specific questions, feel free to reach out to me at lsuagcenter.com, or my personal email address is nwalker@agcenter.lsu.edu, and we'll be happy to answer any of your questions. And Melanie's asking us, do either of us travel for visits to patients? She's in Lafayette. Melanie, I am not a licensed veterinarian. I have a PhD in reproductive endocrinology. However, I'm happy to come travel and help you with some of your management techniques if that's what you're after. I think what you may need to do is, if you're looking for veterinary assistance, you might need to call somebody in your local area. And if you need assistance finding a reference for anyone in your area, again, just email me. I'm happy to help you find somebody that will kind of help you out and help you address some of your situations. But thank you all for joining us today. Thank you for your amazing questions. Dr. McConnico, thank you for sharing your expertise.
It's a pleasure. Thanks, everyone.
Everybody have a great day, and we'll see you next time.